Working with Steve Murdoch, we'd actually started back in 2010. Methodist healthcare ministers had approached us and asked us to start looking at the public policy impacts of the Affordable Care Act on Texas and counties in Texas. In some ways, we didn't know what was going to happen, what the legislation would look like. Once we saw the legislation, we still had to kind of really look at the different population groups would be impacted in Texas and how the likely outcomes to the uninsured population would be following full implementation of the policy. So it was certainly, there was a lot of variability, there's still a lot of uncertainty whether and how different policies will be implemented in Texas and how individuals will respond to the different policies set in place with ACA. In some ways it was a struggle because this healthcare policy, ACA, is something very different than any other thing that's happened. The last major change in healthcare policies was back in the 60s when Medicare was established. And we as demographers, we were most concerned with the different population groups. So we really looked at that from that angle, what population groups were likely to be impacted. And then we try to estimate those groups, and then we had different scenarios based on that uncertainty of how healthcare policies will be implemented. There's certain population groups that aren't going to be impacted by the ACA, primarily the undocumented. So in some ways, in some of those counties that we saw that had higher uninsured rates to begin with are still going to have higher uninsured relative to other counties. But in many ways, they'll see the greatest impacts because they already have a high population uninsured. As we looked at it, I mean, we're really looking at what are the potential impacts to the population in Texas, to how the uninsured and the insured populations would change. And it's really, we hope it is a way for policymakers and other individuals to understand a little bit how ACA will impact Texas. And that's really any work that's done by demographers. That's really what we're trying to do, is to provide information for others to understand the impacts.